Hello and welcome. Today we're diving deep into an often overlooked yet fascinating topic in ophthalmology: conjunctival granuloma. This video will explore what a conjunctival granuloma is, its causes, how it affects the eye, and what can be done about it. Join us as we unravel the complexities of this condition and shed light on its management. So, what actually causes a conjunctival granuloma? The etiology is quite varied. Often it's a response to a foreign body lodged in the conjunctiva. Think of a tiny splinter, a piece of suture material after surgery, or even a minuscule insect part. Other times, it's an inflammatory reaction to an infection, either bacterial, fungal, or parasitic. Less commonly, systemic conditions like sarcoidosis, tuberculosis, or even certain autoimmune diseases can manifest with granulomas in the conjunctiva. In some cases, the cause remains elusive, and it's classified as idiopathic. Let's talk about what's happening at a cellular level. When the conjunctiva is exposed to a foreign body or an inciting agent, the body initiates an immune response. This immune response involves the accumulation of immune cells, like macrophages and lymphocytes, at the site of irritation. These cells attempt to engulf and isolate the offending agent. Over time, this cluster of immune cells organizes into a nodular mass, characterized by the presence of epithelioid cells and often giant cells, surrounded by lymphocytes and fibroblasts. This organized mass of inflammatory cells is what we call a granuloma. The growth of this granuloma can then cause inflammation, irritation, and discomfort. Conjunctival granulomas, while not extremely common, don't discriminate based on age, sex, or ethnicity. They can occur in anyone, but certain populations might be at a slightly higher risk depending on their exposure to potential causative agents. For example, individuals working in environments with a higher risk of foreign body exposure, such as farming or construction, may be more susceptible. Similarly, in regions where certain infectious diseases are prevalent, the likelihood of a granuloma related to that infection may be increased. However, comprehensive epidemiological data specifically on conjunctival granulomas is relatively limited. How does a conjunctival granuloma present itself? Typically, it appears as a raised, fleshy nodule or mass on the conjunctiva, the clear membrane covering the white part of the eye. The granuloma can vary in size and color, ranging from pinkish, red to yellowish. Patients may experience symptoms such as redness, irritation, a foreign body sensation, tearing, and sometimes even blurred vision if the granuloma is large enough to interfere with tear film distribution or affect the cornea. In some cases, the granuloma may be asymptomatic and only discovered during a routine eye exam. Diagnosing a conjunctival granuloma usually involves a thorough eye examination by an ophthalmologist or optometrist. The doctor will carefully examine the conjunctiva, looking for the characteristic nodular appearance. A detailed medical history is essential to uncover any potential exposures or underlying systemic conditions. To confirm the diagnosis and determine the underlying cause, an incisional or excisional biopsy is often performed. This involves removing a small sample of the granuloma for microscopic examination by a pathologist. Special stains and cultures may be used to identify infectious agents or specific markers indicative of certain systemic diseases. While the term conjunctival granuloma describes the overall condition, there aren't strict classifications or subtypes based on specific features of the granuloma itself. However, we can categorize them based on their etiology. For example, we can talk about foreign body-induced granulomas, infectious granulomas, bacterial, fungal, or parasitic, or granulomas associated with systemic diseases. Understanding the cause is crucial for determining the appropriate treatment. Treatment of conjunctival granulomas depends largely on the underlying cause. If a foreign body is identified, it needs to be removed. For infectious granulomas, appropriate antimicrobial, antifungal, or antiparasitic medications will be prescribed. In some cases, topical corticosteroids may be used to reduce inflammation. If the granuloma is large, symptomatic, or causing corneal irritation, surgical excision may be necessary. For granulomas associated with systemic diseases, the underlying condition needs to be addressed through systemic medications and management. Preventing conjunctival granulomas is often about minimizing exposure to potential causative agents. Wearing protective eyewear in environments with a risk of foreign body exposure is crucial. Maintaining good hygiene and proper contact lens care can help prevent infectious conjunctivitis, which can sometimes lead to granuloma formation. Prompt treatment of any eye infections is also essential. If you have a known systemic condition that can manifest with conjunctival granulomas, adhering to your prescribed treatment plan is vital. The prognosis for conjunctival granulomas is generally good, especially when the underlying cause is identified and treated appropriately. Most granulomas can be successfully managed with either medical or surgical intervention. However, recurrence is possible, particularly if the underlying cause is not fully addressed. Recent research is exploring newer diagnostic techniques, such as advanced imaging modalities, to better characterize granulomas and identify their underlying causes. Additionally, ongoing studies are investigating the potential role of immunomodulatory therapies in managing granulomas associated with inflammatory conditions. Thank you for watching.